Hi there everyone, my name is Kim and welcome to the ASA Cardiac Fundamentals Day. I have been a cardiac sonographer for over 20 years. I have also been an assessor for many of those years and I educator and trainer of new student sonographers. I am also now a lecturer with Central Queensland University with their echo course, but I am still working clinically as well. So I have seen quite a lot over the years, and I do notice how physical and mentally draining our work can be, and especially on the new students coming through after COVID, etc. Lots to contend with, but a lot of people don't realise how physically and mentally demanding our job is, especially new ones coming in to the field. As I am a personal trainer as well, I do know a lot about human movement, mobility. So I will talk to you about the physical and mental challenges of being a cardiac sonographer. So for anyone who thinks they can come into this course and be a cardiac sonographer and just take pretty pictures of the heart, and that's all we do, you're sorely mistaken. We're way more than just photographers, and I do hope that you hear this constantly throughout your study and your career. It's not an easy career by any means, physically or mentally, and you've really got to be able to have the physical capability and stamina to cope throughout what could be quite an exhausting day, and also mentally, because we're in the medical field, so we have high stress situations and we need to have the ability to control our emotions as well when looking at diagnostic images on a patient that we can see something that's not quite normal, that could be quite detrimental, and you have to remain poker faced whenever you see some significant pathology and deal with that professionally, and then not take your emotional baggage home as well. So being in a high stress environment and high physically demanding, a lot of these issues aren't really spoken about in this career and through conferences like this. So I'm grateful that ASA has asked me to be here today and discuss this topic with you all. It is a highly rewarding career. So as I said, we're not just photographers. We've got to be basically detectives, really. We're trying to obtain the best quality images that we can so the doctor can make an accurate and more confident diagnosis with the images we give them. We have to look at the image and interpret what that image is telling us, and that then gives us an indication of, do we need to delve further? Do we need to do more investigating to really get the whole overall picture? There can be hidden pathologies, there can be hidden masses, there can be hidden jets of regurgitation. You may not be picking up the full signal of a stenotic valve, for example. So you've got to look for the clues that could indicate that you could be missing something and then investigate further. We've got to go above and beyond, basically. Keeping in mind that surgeons and cardiologists really rely on our images and measurements for them to make their important decisions, such as, do we put this patient on the table to open them up for an operation? More importantly, will they survive that operation? For different treatments, not just medications, but all other sorts of treatments, is there any other further testing they need? So they're really relying on our images, so we really have to be the best that we can and produce the best quality that we can. And sometimes that means high stress situations and putting emotional and physical and mental stress on our bodies. So as I said, it is a physically demanding career. Now, these statistics are from the ASA's survey that they conducted in 2014. And 50% of sonographers said that they exercise between 1 to 5 days per week. Now, do you really think that's a good number? 50%. So I think I'll go into a bit later about how many sonographers actually answered this survey. But even so, 50%. Only 50% say they exercise on a regular basis, or 1 to 5 days per week. Now, it doesn't stipulate the type of exercise, the endurance or the intensity either. So that could be just basically a walk, which I'm not saying is bad by any means, but is that still actually looking after ourselves and actually being physically preparing ourselves for this demanding career. So 67% said they're at a good level of fitness. Now again, the level of fitness isn't really classified or stipulated. So someone like me who's a professional athlete may think differently to what a good level of fitness is compared to someone who goes for a couple of walks a week and thinks that's a good level of fitness. So again, that level of fitness isn't defined really. 89% have claimed that they have had pain or discomfort since starting their scanning career. Now you can see this full report on the ASA website. These are just a couple of numbers that I grabbed just to show you some indication about the high numbers that we're getting of people saying that they're having some pain, niggles and injuries, etc. Now also not forgetting that we work in a dark room, so eyesight can be compromised as well. So doing exercises for your eyes, moving them up and down, and again, ASA have these on their website, but you need to make sure you also get some sunlight because we're in a dark room. Get that serotonin in, which makes us happier and less stressed, so which can help along with the day and make the day a lot more smooth running, I suppose, and happier for us. So I did mention that I'm a personal trainer as well. So I am very proactive about how I prepare myself for a day of scanning. Now, because we're in a static position for most of the day and engaging those muscles, contracting those muscles in a static position for most of the day, it's important that we activate them and warm them up before we start our day. Same as if you were doing a workout. So stretching versus muscle activation. Some work better for, so stretching I'd say would work better if you're starting to feel some pains. Definitely in the morning if you need to feel you stretch. If you need to stretch, absolutely go for it. It's not going to do any damage at all. It's just that we also want to activate some of those muscles because if they're going to be in such a tight contracted state for most of the day, you want to start getting some blood rushing to those areas and get that muscle pre-warmed before we then basically put it in a permanent workout position for the day. So definitely recommend stretching throughout the day as well, especially if you're starting to feel neck soreness, stiffness anywhere, etc., etc. So make sure you do those exercises, and I'll pull up the next one, which is some of the exercises that the ASA have on their posters that are for sale. This is always great to grab, purchase a poster and have it in your lab. It reminds everyone during the day to do some exercises. So if you do have a 5-minute break or even in between patients while you're waiting for numbers to download, you're grabbing a drink of water because you want to make sure you stay well hydrated. So here are some of those exercises that the ASA produce. They've got posters for sale. So it's highly recommended that you do get these and pop them in your labs. It's a good reminder for everyone to do these sorts of stretches and activations throughout your day. So if you've got 5 minutes between patients or if you're waiting for numbers to download while you're getting a drink of water because you want to maintain that hydration as well. Or if you're just going out for a quick sunlight exposure, do some stretches while you're out there. But these are available on the ASA website. So we want to, as I said, we want to make sure we're activating those muscles. Now, I also do, I'll just go back to that slide for a second, because I also do have specific exercises on my YouTube for sonographers, as well as general population, and they're all very good for anyone, especially if you're getting some niggles and aches and pains. We want to try and avoid those and minimize those. So along with the ASA ones, I do have some different videos on my YouTube, or please feel free to come and ask me. But also if you are getting major pains, definitely get them checked out by your local general practitioner, or if you've got a good physio or massage therapist, highly recommend looking after yourself and getting treated, because we want to maintain our body and our musculature and mobility, rather than we want to prevent things rather than sort of trying to fix things along the way. So prevention is way better than cure, as we know. So let's try and prevent these things from happening. So dominant arm. Now, a lot of us will scan right-handed in Queensland, and a lot from New South Wales and further down south will maybe scan left-handed. It's independent, however you want to. I highly recommend that you try both arms, and it is very beneficial for you and also for your ability to, as a sonographer, to be ambidextrous and be able to at least get some images with both arms. In situations like ICU, cath lab, theatre, you may only have one choice of which side the machine can go on, so therefore one choice of which arm you can scan with. So make sure you do try both. You will feel a lot more comfortable with one than the other. And of course, depending on your dominant hand in writing and things, you may have more refined motor skills with one than the other. But have a go at both. And as I said, it's very beneficial to be able to do it, to be able to scan in with both arms. Now I'm just going to pause my recording. I'm going to show you 2 videos that I've done just in regards to some tips and tricks on how to position yourself, set yourself up and the patient up for both left and right-handed scanners. Okay?
Hello, I'm Kim, and I'm going to give you some quick tips on ergonomics before you start your scan. So you've got your patient on the bed in position. For right-handed scanners, as close to the edge of the bed as possible, okay? They've got their left arm up as high as they can for them. You're then going to look at your chair and see how that needs to come up and down for your body position. So the chair should be able to rise or lower depending on where your legs can and sit. So your feet should be either flat on the floor or nice and flat on the machine so that you can keep a nice straight spine. Again, the patient is close to you, so you're not leaning over the patient. The next step is to make sure your machine is nice and close to you. You don't want it far away, you don't want to be stretching. You want to bring it nice and close to you and raise it or lower it accordingly. So again, you're not lifting your shoulder up or lowering it and reaching it. Once all that's into position, you need to have your bed raised to the correct height so that your arm is just resting gently on the patient so that you're not holding your shoulder up. Just rest it gently over the patient. So raise the bed comfortably, again, so that you're not leaning over the patient. It should just rest comfortably in a neutral position so that you can keep your back straight and your shoulder is supported. So that's the quick steps. Make sure your patient's nice and close to you. Make sure your seat is nice and at the correct height for your feet. Bring the machine close to you, resting your arm on the patient. Then pop your screen into correct position so your neck and head are not twisting, and then you're ready to scan. Through some ergonomic tips for the left-handed scanners. Same steps apply. Make sure you've got your patient set up first, close to you as possible, but for the left-handed scanners, they're not going to be on the edge of the bed because you need to get your elbow into position on the bed comfortably so that you can hold the probe into position. Make sure your seat is at the correct height for you so your feet are again on the floor or comfortably on the machine. The bed height is the next thing. Now for left-handed scanners, I find that it's usually a little bit higher because you need to get into the patient and rest your elbow comfortably on the bed so that your spine is not bending. Sometimes I find putting a pillow behind the patient for left-handed scanners helps them stay a little bit more steeper and makes them feel a little bit more secure. For your left-handed scanners, you want to have the probe in your hand and your elbow just resting gently on the bed without too much flexion in the wrist. Okay, so if you're flexing the wrist too much, you'll need to bring your elbow back down the bed a little bit into position. So your elbow positioning should be like so. It should not be like so. This is going to put more strain on your wrist and your shoulder. So bring your elbow back down towards the feet a little bit more. Raise the bed to where you can comfortably sit so your back is straight and hold the probe into position. Now again, same as the right-hand scanners, I'll anchor myself with either my thumb or a finger on the patient's chest to hold the probe steady. If you need to apply a little bit more pressure or tilt the patient, grab their other shoulder and just gently pull them to you or push them away from you, but still move your elbow a little bit closer to the patient so you can apply that little bit more pressure if needed. Screen and keyboard are the same. Make sure you bring it close to you so that you're not reaching and at the correct height for you. Screen again into position so that your head remains straight.
Okay, so as you saw, that's just some tips and tricks on how to set yourself up and the patient up before you start scanning with either of your dominant arms, whatever side you scan with. Very important to make sure that you do set yourself up and your patient up correctly before you do start scanning for the day. Remember, you're doing this all day, every day. We want a long career. We certainly don't want injuries within the first 5 years of our career. So again, ASA have another posture type of poster for you that you can pop up in your lab so that, again, it's a reminder for everyone. So making sure that we're sitting straight, ears above shoulders, above hips, above knees, above ankles. Now, whether that's sitting or standing, okay? Make sure you keep an eye on your posture during the day. With students, we see that they tend to look forward and tend to stick their neck out looking at the screen, or they start to then sort of angle sideways if the patient's smaller or reaching away from them. So they're reaching further, starting to twist. I advise against sitting on the bed behind the patient because, again, you're going to be twisting. We want to be stationary and facing forward, facing the machine. Sometimes in ICU or in the wards, if you have to sit on the bed, sit kind of to an angle so that you've got the machine off to the side so it's facing you directly and you're limited twisting around the patient. Again, we're not going to be in an ideal situation 100% of the time, but the less likely we are, or the less time we've got in an awkward position and an uncomfortable position, the less likely we're going to have an injury. Okay, so let's go more into that, setting yourself up. So I have a 3-step sort of a system that I like people to think about before they start the scanning. This is for every patient. So you want to make sure that you've got the ergonomically friendly machine, bed, chair, etc. And so you can adjust it accordingly. Now, some of the centres do have just the portable laptop machines, which are fine, so long as they're on a trolley or something that you can move around or even adjust the height. Most of them are on their own trolleys that can adjust the height. If you're on a higher end machine, those consoles come apart and move around. The screen tilts and moves, and some of them are even on their own arm and can move around. Easily mobile machines that have got brakes and four-wheel drives, just to make it easier for mobility as well. Because remember, when you're pushing the machine, you don't want to be running over things. You don't want to be pulling. Pushing it is a lot easier, and that's why the handle's at the back. So make sure you do think about everything, even when you're moving the machines. Footrests, as I said in the videos, make sure you've got your feet either on the footrests or on the floor or on the rings on the chair to make sure you're stable and facing in the right position. And so then the next step is making sure the bed and the chair are comfortable and set accordingly. So our beds should have the mobility to go up and down. With a foot remote control is the best, so that you don't have to use a hand to do your remote control, that it's all by your foot, because you've got one hand on the machine and one hand on the probe. You don't have that third hand to do things. Your chair, again, should be able to rise and lower. One of the examples is a saddle chair, and that just helps to separate the legs a little bit to stabilize the pelvis. I do like a backrest, and I sit right back against the back of the chair, have that support in my back, and then I've got the ring of the architecture chairs so that I can put my feet on that. Again, lower it down so that your feet are planted on the floor, whichever you find is more comfortable. Not all beds have a cutout for echo, and that's okay. They don't all need to. just so long as it goes up and down. Now, the next step, which a lot of people wouldn't even think about really, is to ensure that the ECG is appropriate, it's going to capture correctly, and is free from artifact as much as possible. We want an ideal situation like this, not like this. The more likely it is to not capture correctly when we've got artifact, which creates problems in our imaging, which creates problems with the doctor being able to diagnose it. Okay, you don't want to do a full scan and notice that your images haven't captured properly, and you have to go back and do that. Okay. Also, it can be extremely frustrating if it's not capturing properly, and I hope everyone has their predecessing image capture on it so that you can see what is happening, so that you can see your clip before you accept it. Okay, because you want to make sure that you've got those correct clips and those diagnostic clips. As I said, nothing worse than noticing halfway through or at the end of a study that nothing has clipped properly. All right. So yeah, and remember, the more frustrated you're getting throughout the scan, the more stressed you're going to get and the more anxious you're going to be. So here's some more stats from the ASA survey in 2014. Now, this is just demonstrating some common areas where sonographers get pain and discomfort. Now, remembering this is from all sonographers, so general, vascular, cardiac, etc. So it's not just focusing on cardiac. Now, from this survey, in Australia, we've got 5,000 registered sonographers, and 360 took part in this survey. And that's sort of what I was alluding to before about the stats with 50% were saying that they exercise 1 to 5 days a week. So it's 50% of 360 people. Not a massive amount that really that accounts for. And again, that's not taking into the whole of the Australian sonographers. But the highest slight pain area was of the lower leg of the non-dominant scanning side. Now remember, this is not just cardiac, and I don't know how many cardiac sonographers actually participated in this, but what do you think that would be to? So think about how your non-dominant, so if I'm scanning right-handed and my left leg is getting pain, think about how you're standing, and are you bracing yourself with that leg or at an angle to create pain? So again, for cardiac sonographers as well, think about how you're bracing yourself. If you're sitting on the side of the bed, are you actually sticking your leg out to hold yourself up, which will fatigue quite quickly, and especially if it's at an angle, it's going to cause issues. So think about how you're sitting. And then the next one is the lower leg of the other side, of your dominant side. Now, the highest moderate pain was in the upper back. So here's our moderate pain. Was in the upper back, and the highest severe pain was in the forearm of the scanning side. So this makes sense, especially for cardiac sonographers as well, but all general sonographers, because you're in that static contracted position for a lot of the time holding the probe. Forearm, okay? So that means you've got to think about how you're holding the probe. How tightly are you holding the probe? Is the probe too skinny for your hand? Therefore, you can get a rubber casing to make the probe a little bit thicker. I know some of the Philips machines, their probe is quite thin, so you can get a rubber casing to make it a bit thicker. Think about things like that. It should be able to maneuver the probe around in your hand quite loosely and have full control of it, really. Think about having an anchor point on the patient, so you've got a pinky finger or a next index finger just resting on the patient or the bed, so then you can maneuver that hand. Straight wrist as well while we're holding the probe, and again, we're not holding on for it for dear life. Relax that forearm. Okay, so they're those main areas that sonographers have sort of said that they're getting the most sort of aches and pains. I do notice in students, in the cardiac students, their shoulders are starting to, they really feel it in their neck and shoulders, but I do notice that they kind of either are hunched up, they've got their arm too high, so the patient's too high and the bed's too high. You don't want it dragging down either. So you've got to get that, find that comfortable position for you. Okay, and this just means constantly reassessing your posture. So have a look at your posture. Here we go, reviewing this posture. We shouldn't be leaning over like this. We want to be nice and straight up and down, and having the patient close to us if we're right and a little bit far away if they're left, so we can get our arm in, okay? As I said, some places like ICU, cath lab, you're not going to be able to get in that prime position, but in those situations, you need to just quickly get as much information as possible and then stand up and have a break. Do your measurements offline while you're there with the patient if you need to, in case you need something else, and then you can go back in. If it's an emergency situation, you just get in the answers for the doctor quickly, okay? Again, try to get the optimal position as much as we can. I'll move the screen even 0.5 millimeter if I need to. If I start to feel a burn in my neck, I'm going to move that screen, okay? It can make all the difference in the world. Remember, this is your 8-hour-a-day job for however many years you're going to be doing this. And we want that to be a long time. As I said, review how you're holding that transducer. Make sure your wrist isn't flexed or bent or anything. So and nice and straight at all most of the time. Sometimes it's not all possible, especially if you've got quite an obese patient and trying to get around a few things. But again, make it minimal, have rest breaks if you need to while you're doing a measurement, rest the wrist, etc. So make sure you're checking on that constantly. Now, I have alluded to the bariatric patient or the obese patient. Now, we do think about the field that we're in. We are going to come across this occasionally. And again, in ICU, where they're maybe not mobile, or you're going to have those patients in rehab, etc., that are not able to be mobile, and you have to try and get around these patients as best as you can. So you've got to think about how you're going to deal with this as well. Now, the definition of a bariatric patient is a BMI of greater than 30. So they are often less mobile. You may need to help adjust the patient. You may need to help them get up out of the chair, etc. Now, there's certain ways of doing this. You also want to minimize your scan time. As I said, take breaks. Do some measurements while you're having a break from your hand, pushing in with the probe, and then go back in if you need to. ICU, you may need to stand next to the patient, but make sure you raise the bed up high enough so that you're not leaning over. For lefties, again, put that wedge between or behind the patient, or even for righties, if you need to put something underneath your arm so that you're at a nice level with the patient, if for some reason you can't get them in that optimal position. Again, in the cath lab, you just have to deal with if you need to go left, you haven't got much room, you're trying to get in under covers and wires and other machines as well. So quick picture, come out again, because they'll probably be screening, do some measurements or whatever you need to, go in again. Okay, so do what you sort of need to do that best serves you and the patient. Now, with our patient handling, if in the case of a bariatric patient that they cannot move themselves and cannot get out of bed, then you're just going to have to go bedside and deal with it as best as you can. Again, lower the bed. If they're a really big patient, lower the bed so that you can easily get your arm over, and you'll have to just try and get into that optimal position as best as you can. When we're trying to get a patient out of the chair that needs assistance, now most cardiac centres, most hospitals have patient handling courses, which is just a couple of hours a day. It's like an induction course. Please take advantage of this if you are in a centre that does offer these. Now, we don't grab the patient by the arms and pull them up. We don't want to pull their arms out, and we don't want them to pull our arms out of our shoulder sockets. And we don't lift up from under the armpits either, okay? So if you're doing a one person movement, you can go in this image here. We're going to grab them from behind. We're kind of giving the patient a bit of a hug and helping them to stand. You're advising them and encouraging them to use their legs and their core muscles, which of course are probably diminished after being in hospital or whatever their issues are, but you try and encourage them to use that. If you want to go from the side, then you're going to put one hand behind their back and then one hand in front of the shoulder. And look, I'm not going to fully go into this, but there's certain ways of that, and you're just going to, again, encourage them to use their leg muscles, push up from the chair, and you're going to guide them by pushing them from the back. Help them move by just holding their arm to just get to the bed, etc. So yeah, don't pull them by their arms. Don't let them, if they're going to getting up from the bed, don't let them just suddenly grab hold of your arm. You're going to go behind them using your legs, of course, not your back, and you're going to guide them and pull them up. Now, patients who have just had bypass or a pacemaker, again, you're going to have to do a lot of the work because they can't use their arms, etc. But there's ways of doing that. So I highly recommend you do a patient handling course. And even if your centre doesn't have them, get someone to do an internal course for you guys so that you're aware of how you should be and shouldn't be moving patients for the safety of you and also the patient. Now, break times. We're in the medical field and break times can be few and far between sometimes. So the current guidelines these are the Queensland guidelines. If you're worried at all, just check your local state or territory, and make sure you do get some form of a break. And again, it's ideal to get that sunlight, so we get that serotonin because it makes us feel better, especially if we've had a stressful morning and you've got to get through the afternoon. We want to have that happy face on again and be able to be our best for the patients. So you should try and get a 30-minute break or an unpaid meal break between the 3rd and 6th hours of your duty. Rest, there's some rest or paid rest breaks of 10 minutes for an employer who works 6 ordinary hours or less in a day. And again, this is all this is from the Queensland Employment Hospital and Health Service General Employees Award of 2015. So breaks are important, that we get that little bit of reprieve from our muscles, and also, do some eye stretches. But again, as I said, get hydrated and get that sunlight if you can. Do some stretches, even if you're sitting, just doing some stretches. I think the ASA poster had some sitting stretches. Move the legs, just do some movement just to keep, even if you just tense up everything and then just relax it. Take some deep breaths, do a quick meditation if need to, because that's great for the mind and the body as well. Make sure you do get something to eat wherever possible. Again, if we're hangry, we get frustrated and stressed, and anxiety levels go up and our tolerance levels go down. So this is just something from this is from Managing the Risk of Psychosocial Hazards at Work from 2022 Code of Practice from Queensland. Now, no one really likes to talk about the mental pressures of healthcare and how we deal with it. I'm not sure why, because it's everywhere. It's, healthcare is rife, and it is actually one of the top occupations that suffer a lot of mental health issues and stress and anxiety. So by managing our psychosocial hazards, we can then help hopefully manage our career and our longevity and be better persons in ourselves, but also therefore better for our patients, and we're providing that better quality of care. By recognizing common hazards and the role they play in our stress response and our psychological response, which also can lead to physical responses. So remember, psychological responses and harm can cause some physical harm as well. So again, I won't go into too much depth in this, but this is managing your risks of psychosocial hazards at work. And so things like even just clarifying the role you play within your workplace, sometimes low recognition, low rewards, workplace relationships can cause a lot of anxiety in people as well. Bullying is a big one. So if you're at all worried about something, make sure you speak to your supervisor or a cardiologist or the HR person in your department, so that you can put your mind at ease, but also make sure that you need to work things out if that's, if something needs to be worked out, because everybody wants to be happy in the workplace. Again, this is where you're going to spend the majority of your life. So you want it to be as happy as possible. So what are some mental stresses that we as cardiac sonographers would face? Sick patients is a big one. Sick patients can be stressed out. They can be anxious, very worried. They can have low tolerance levels as well for anything really. They can be seen as uncooperative as well, just because they're scared and they don't know what's happening. They can then become aggressive as well. So we have to be able to deal with that. We also have to be able to put our emotions to the side to a point so that we can remain calm, stress-free, and deal with those patients accordingly and with care. Doctors wanting urgent answers in an emergency situation or in the emergency situation itself. So if you've got 10 doctors hounding you, looking over your shoulder in ICU after an image or something, and you're having trouble getting that can raise your anxiety levels as well. You can feel quite stressed, and I've had poor students feel really overwhelmed and like they're going to pass out. So you need to make sure that you are able to control yourself in these high stress environments, because the doctor's needing that answer, so that especially if it's a really, really sick patient that's, it's a life or death sort of a situation, which we can encounter. The emergency situations such as arrests or respiratory arrest or anything else that can occur that requires us to either quickly have a look if someone's having tamponade, they want to see what fluid is happening, if the heart is actually tamponading, and then if the patient arrests and you're dealing with that situation, you then have to make sure that you can remain calm and in control, and again, pop your emotions aside and deal with the situation at hand. We may have to deal with patients' carers or family members that are there. Then later on, you might have to have a debrief. I highly recommend you do go and have a debrief in those situations. These situations can be quite emotionally stressful, and you may not think about it until later on that evening. Make sure you've got someone to talk about it with. Patients who arrive late in your list, and you've got a big waiting list, you've got a huge waiting list, and you've got patients arriving late or not turning up, that can cause a lot of stress in your day. And then, of course, poor image quality, especially at the end of the day. If you've had patients turning up late, you've had difficult patients, and then all you need is that last patient to have pristine images, and you're just fighting to get a nice image. That can be really taxing emotionally and physically. In those situations, go and get someone else to have a go, because if two people can't get it, then okay, maybe we're doing the best we can and we just can't produce the images, the high quality images that we need, but you need to go and get that person to have a go, and then just do the best you can with what you can, all right, with the images that you can get. We are in medicine, we are in healthcare, we're in medical imaging, so it is a very stressful environment, and you need to understand that. But you need to be able to understand how you can cope with it, and there are mechanisms to cope with it. Recognize the triggers, recognize situations that may cause you stress, anxiety, and then recognize how you can deal with it yourself. Whether it's through talking to people, having debrief sessions, having internal meetings about different scenarios and situations and what you could do better as a team, etc. There are accessibility plans and mental health plans through certain hospitals, and they can offer different counselling as well if you need to. So how you cope under that pressure is what matters, okay? Now, there are OH&S guidelines that have just recently been introduced to some of the Queensland health code, work code of practice in 2022, and describing the different hazards affecting mental health and how to avoid these hazards. Now, since COVID as well, we've had COVID burnout, which was a major stress on the healthcare system and all the workers there. So from this graph, mental stress and work pressure is the highest percentage of OH&S work cover claims. Okay, so you want to avoid a work cover claim, whether it's physical or mental. So we do have to look after both our mental and physical well-being. Now, the Office of Industrial Relations Mental Disorders states that 3.4% of all accepted serious workers' compensation claims were for mental health disorders. 871 Queenslanders are compensated each year for mental health, with 85 work days typically off work for mental health. So, work pressures can lead to things like anxiety and depression, and then you sort of that's, if you don't take control of it, it can sort of spiral you. So you want to make sure you're taking control and doing the things you can, as I said, avoiding those triggers or recognizing the triggers and knowing how you can best deal with those. It also states, so this is the workers' comp, as I stated just before, the most at-risk occupations are the health and welfare support workers, along with Defence Force, fire, police, and bus and rail drivers. So we are in that occupation where we're at the most risk of mental health, occupational hazards. So I mentioned that arrests can be quite emotionally taxing as well as physically taxing, especially if you're having to perform CPR. So also dealing with the family members, etc. So those are sorts of different stresses that you should have a protocol in place as well for the arrest and for the emergency situation, that so you know to a T what is needing to be done and how you deal with that. And then later on, I hope that each centre has a debrief session with as part of their protocol on what to do. Again, looking at the situation, how everyone managed, is everyone doing okay, and what could be done differently or better. When you see a pathology as well, if you're just doing your little scan, not expecting anything, and then all of a sudden you see something that's really worrying, and you've got to remain poker-faced and do what you need to do. So go and get a cardiologist or whatever the protocol is in your centre without alerting or worrying the patient that something is wrong. So you have to be able to maintain that professionalism when you're finding something serious. So a lot of this can be and if you're trying to hold all that in, you've got to make sure that you are, it's not taking an emotional toll on you. Okay. So this is just an example of poor image quality that I mentioned. This is the last thing you want to see at the end of the day. You want to see these sorts of images. So as I said, go and get someone to help you if you're struggling. If I'm really struggling, and I know I'm fatigued or something, I'll go and just get someone else to have a look at for me, just to make sure I'm not that fatigued that I'm really not getting the image that I need. But sometimes just a different set of hands that are less fatigued or, may just get on the magic spot for you that you just haven't been able to find. So, and there's no, harm in that. There's no, you shouldn't worry about whether you can't get a picture or not in that. So make sure you do, because remember, this is the quality that we're trying to get for our patient and for the diagnosis for the cardiologist. So do the best you can in that situation. So I've mentioned a few of these already throughout this talk, but debrief with your workplace or debrief at home with family or a counsellor. Get your physical exercise. Make sure you are keeping yourself healthy. Remember, your body is your temple. Meditation is a really good thing that you can do as well. And you can easily do this at work when you've got 5 minutes. If you're having your lunch break, if you're getting out in your sun, you're just doing some breathing techniques to calm yourself. Do something you do enjoy when you're outside of work. I know if students, you're trying to study, do have half an hour to go for a walk or do a painting or roller skate, whatever it is that makes you happy. Do something that you enjoy. Know your protocols. So especially in an emergency situation, know your protocols and what you need to do in that situation. So it should be all very smooth sailing, and then you can debrief at the end. Definitely seek help wherever you need it. If you feel things are getting on top of you, inform your supervisor, go to counselling, get the help you need it, okay? Look at how you've got your setup. Make sure you set yourself up for every patient. Every patient is different, so every patient will require you to set yourself up differently, okay? Think about how your posture is throughout the day for every patient. Make sure you're doing those activation and stretches throughout the day, and breathe. Okay, so please feel free to contact me for any further information on this subject. It is something that I think we need to talk more about, especially in cardiac imaging and in general imaging. And but it's something I hope that, if we look after ourselves, you will have a long and enjoyable career. Thank you.